ready for you, Mr. Jones? Just a little bit more, just a little bit. Half inch that way. Okay.
So now in the media, there's a rumor that Odell Beckham Jr. is coming back from his ACL injury. Last time, this is his second ACL injury. First one was in 2020 against the Bengals, and the second one was last Super Bowl against the Bengals again. It's been 9 months since he had that injury. So around this time is 9 months after the surgery, which is the typical time frame where most athletes are cleared to return. Now, up to this point, he has been medically clear, but he still feels like he needs to get the rhythm and conditioning to get into football in the middle of the season. And now he's trying to find a team that will sign him for probably is going to be a short term. I don't believe that with the amount of injuries that Odell Beckham Jr. has had, any team will take the risk of giving him a long-term contract. It will be something more than a year-to-year basis. This is the same knee that he injured back in 2020, so it's what we call a revision ACL surgery. For athletes returning to the pre-injury level after an ACL surgery, most athletes, the data says, after a first ACL injury, 90% of the athletes return to a pre-injury level. But after a second ACL injury, after a revision injury, then that percentage drops to 60%. So having in consideration that this is a second injury, I don't think he's going to get back to the level he was before, but still he's a very good player. So any team is going to want him at least to be part of the playoff run. So what's in question here is which team is going to take that risk. Because I have a list here of all the injuries that he's had since first started in the season. It's his 8th year. Multiple hamstring groin sprains, multiple ankle sprains, inguinal hernia. He's had the ACL, shoulder injuries. So it's an extensive list of injuries, and we've seen him. He always misses 2 or 3 weeks each season. So there's a trend here. He's a very athletic, but somehow either he doesn't control the way he falls after reaching for a ball, or his ligaments are not as tight as you want in a player of this caliber. Well, the question of is there anything in his genetic constitution that makes him prone to injuries? There's a proven theory that in females are more common to have ACL injuries. Theories are the shape of their bones, the way their brain is connected to the muscle in terms of how they land. There's also a theory of hormonal. There's a couple of studies that shows that females that have ACL tears occur at a certain time on their menstrual cycle. So hormones has an impact on the strength of the ligaments. In terms of males or athletes in general, the patients are called double jointed. The ones that you see that they can bend their torso and touch heads with the knees, or you straighten the elbow and the elbow kind of pops out. Another test that we do is try to touch your thumb to your forearm. Those are kind of clinical findings that a patient is double jointed of has too much laxity on their skeleton. So patients with hyperlaxity tend to have more injuries than the ones that are stiffer, and that's the way they're built. Okay, that's their genetics. If you have a patient like that, then you tell them you need to build a lot of muscle strength, because then the muscle is what's going to contain the joint in the adequate range of motion and not hyperextend. So Odell Beckham, you see him, he's strong, but he's still very thin. So there might be, this is just my opinion, there might be some sort of hyperlaxity that puts him at risk of this many injuries. For example, ankle injuries. Patients are hyperlax, that ankle is very loose, so when they step wrong, that ankle rolls. And with the ACL, when you land, your knee goes backwards, and that's how you have a tendency to tear your ACL. Shoulder problems, can't mention how many young females have shoulder problems, is because the shoulder is the most mobile joint in the whole body. So it's not really contained by the socket, being a ball in a socket. So you need to rely on your muscle and your ligaments to do that. One of my theories, he might be a double jointed kind of individual from his youth. Laxity means the joint moves within the normal parameters, but a little bit more.
Mm-hmm.
So for example, my elbow doesn't stick out.
Yeah.
But if you get a teenage female and you tell them straighten your elbow, you'll see like it pops up a little bit. So that's still normal range of motion, but you can tell it's a loose joint.
That person might be at more risk of something happening with their elbow.
Correct.
Mm-hmm.
Another thing that I can say is, in terms of an ACL, I think when it's not in the high-end elite athletes, for example, Odell Beckham, Derrick Rose, those type of individuals, when it's more on the high school or even in college, there's a tendency of specifically parents to look for surgeons that will be willing to release the patient earlier because they are pushing for a scholarship run, or they're very good, or they have scouts, or they just want to finish the season in good terms. So I've had that experience. I'm set on 9 months post-op because there are studies that show if you go back earlier, the risk of re-injuring your ACL is higher. Now, in a younger individual, it might not happen. Okay, you might take the chance, you might do well, but the odds are against you if you get back into an earlier than that. And I've seen surgeons trying to market themselves as, you see it in the region, market themselves as you can get back to after an ACL in 6 months, 5 months. Yeah, you can, but doesn't mean because you can that you should.
Yes.
So people out there should be aware of that. One thing is what you can control, which is how much you put into the rehab, how much you go to the physical therapy, you do a lot of strengthening, and young kids might feel ready at 3 months. But one thing that you cannot control is the biology, the time that takes your tissue to integrate into your body. We don't have any control. We can do stem cells, we can do a lot of adjuvants or injections to improve that, but it has stated that the ACL matures after 9 months. If it's your own tissue that they use to reconstruct it. If it's, a cadaver donor tissue, it takes longer, 12 to 18 months. So we can just focus on what we can control, but let the body heal at its own pace. So that's also the why 9 months to return to sports.
That's like a hard rule.
In my practice, it's a hard rule. I've done some exceptions. For example, the ACL is at its maximum function when you do a sport that is cutting, pivoting, acceleration, deceleration, those changes in directions. That's when the ACL it's at its maximum function. So, and jumping, landing mechanics. So if a patient plays any of those sports, I tell them 9 months. Now, I've had patients that tear their ACL in football, but they also are sprinters in track. In track, because it's a straight line, I've had patients going back to sprinting in track and field at 6 months. Mm-hmm. Because the ACL is not at high risk of re-injury during those type of sports. Obviously, just sprinter. They're not going to go triple jump or long jump. That's jumping, landing, and that's when they can get injured. Or the same thing if you're a thrower and then you need to spin, and that's also a mechanism of injury for the ACL. So every patient is individual, but in my practice, 9 months is the key. And I tell the parents, I tell the kids, this is what you should expect. I've had patients that don't want that, so they go to another surgeon. I base my clinic, my practice on results.
Yeah.
So I've had better results if the patient goes out to sports after 9 months. That it's cutting or pivoting, basketball, football, tennis, sports like wrestling, and we might be able to negotiate track and field so long as I'm in line. they can go back earlier. Softball depends because you're in the outfield. The outfield is uneven surfaces, so that might be a problem. The ACL, another function of the ACL is balance. It's a receptor that tells you where your foot and your knee is in relation to the ground. So if that perception is not retrained, then
you wouldn't really know where your leg is.
It's very minimal. It acts or activates in a matter of microseconds, but that microsecond might be enough for you to get re-injured. So if I was in the NFL, if I was a owner or a GM trying to hire someone for the playoffs, what I would do with Beckham is I will hire him for the rest of the season, coming playoffs, short-term contract, with an option to re-sign on the next season, depending on how the percentage of it, because I think it's gonna be around 80% of his max. Now, if I was Odell Beckham, depends on his ego, because he's a superstar or was a superstar. He might not take a short-term deal, but the odds are against him because of all this amount of injuries that he had. I don't think there's any GM that will offer him a long-term deal. If I was Odell Beckham, I'll take whatever I can get and then prove myself that I'm worthy to keep over the next few years. There's not a brace on the market that you can wear to prevent an ACL injury. Braces are more for when the patient lacks that confidence going back so they can feel secure. But there's no data that has shown that there's an ACL brace that prevents any re-injury. I do send patients back to their sports with an ACL brace because I think that gives them more confidence and they can loosen up and be more themselves when they play with a brace. But I only do that for the first year back, and I tell them after the first year you can just choose to wear it or not. So probably he will come back with some sort of brace. He just needs to continue doing that neuromuscular training over and over, have video analysis when he trains to make sure that when he lands in a correct manner. It's difficult in football because you don't know. You're planning to land because you're in the air, but while you're in the air, you have someone hit you, and that changes your whole perspective. And instead of you landing on your shoulder, then you want to put a leg in it, a leg on the floor. That's when the unpredictability of the sports causes so many ACL.